Hi, it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog, I talked about side effects of long-term ventilation at home and in intensive care, or LTAC. In this week's blog, I want to talk about how we at Intensive Care at Home maintain quality, keep our staff up to date with training and education, and therefore how we safely manage to keep our clients out of intensive care or get them out of intensive care in the first place. So today's blog post is about education days at Intensive Care at Home for our nursing staff to keep delivering a high quality service. Part of working with the specialized intensive care at home nursing service like ours is to maintain quality and safety aspects so that our clients can go home from ICU or pediatric ICU or stay out of ICU or pediatric ICU if they're at home already, so they can be safely looked after at home. Besides being the first, and as of June 2019, the only third-party accredited service in Australia that has accreditation and certification to provide intensive home care nursing for ventilated patients at home, we take safety for our clients and their families very seriously. Besides having a minimum of 2 years ICU or pediatric ICU experience, all of our staff go through annual training such as an advanced life support or basic life support course. These are our minimum qualifications that staff need to have. However, the reality is that we currently employ over 200 years ICU and pediatric ICU experience combined, therefore making us and our specialist skills the leading service in Australia when it comes to long-term ventilation with tracheostomy at home. Some of the training we are providing is in-house, or we sometimes engage external providers to facilitate such training and maintain and improve the skills of our critical care registered nurses. Such training days are also a good opportunity for our staff to connect to each other. The reality of running a remote intensive care at home nursing service is also that staff only see each other at handover time. Sometimes staff haven't met each other at all because they work with different clients. Therefore, the training days are fantastic opportunities to get to know other team members. Last month, we had such training days for our critical care nurses, and we engaged Karina Hull, a very experienced intensive care nurse, to run the accredited course. Karina is running her own training organization called Resus Ready, and we had the pleasure of Karina providing advanced resuscitation training with our very talented and skilled critical care nurses from Intensive Care at Home. We also invited some of our clients to one of the training days so they could feel more comfortable and reassured when they're at home with their loved ones and our nurses to respond appropriately in case their family member has a medical emergency. Karina knows intimately what it's like working in an intensive care unit. Therefore, Karina certainly understands the need for long-term ventilated patients to go home into a better, more holistic and more patient and family-friendly environment. For adults and children that are medically stable but still require assistance with breathing, with a ventilator, with tracheostomy, or need extra assistance with medical management of medically complex illnesses, it just makes sense to go home with a specialist service like ours, Intensive Care at Home, instead of staying in intensive care long term. With our specialist service, Intensive Care at Home, these sick but stable patients can recover in the comfort of their own home with their family and in familiar surroundings instead of staying in ICU or pediatric ICU long term. Besides improving the quality of life for patients and their families at home, Intensive Care at Home cuts the cost of a $5,000 per bed day ICU or pediatric ICU bed by 50% and also frees up in-demand ICU and pediatric ICU beds, and therefore we create a win-win situation. Intensive Care at Home really values providing ongoing education and training for our staff, which is why we brought Karina Hull from Resus Ready along to refresh our staff skills in advanced resuscitation and tailor the resuscitation course to include extra components that is relative to our work and our clients. Resus Ready offers a range of courses from CPR refreshers, first aid courses, all the way to advanced resuscitation. Resus Ready also tailors their courses to make it specific to your workplace and relevant to your staff. And the training with Resus Ready was definitely fun, interactive, and it's a great team building experience for our staff while also learning valuable skills that can save lives. Thank you for watching. If you want to find out how we can help you to get your loved one out of intensive care, including palliative care or long-term acute care, or also out of a nursing home, or if you find that you have insufficient support for your loved one at home on a ventilator, or if you want to know how to get funding for our service, or if you have any questions, please send me an email to patrick@intensivecareathome.com or call me on one of the numbers on the top of the website. If you send an email, send it to Patrick, P-A-T-R-I-K, @intensivecareathome.com. Also, have a look at our careers section. We're currently hiring intensive care nurses and pediatric intensive care nurses for clients in the Melbourne metropolitan area, northern suburbs, Mornington Peninsula, and in South Gippsland, Victoria. We are an NDIS, TAC, and DVA approved community service provider in Australia. Also, have a look at our range of full service provisions on the link of our website. We have also been part of the Royal Melbourne Health Accelerator program for innovative healthcare companies previously. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.